physicians, I've created a digital training format where I'm gonna treat people because the results that I'm getting are just beyond imagination. I teach all over the world. I spoke in London not too long ago, so I want to share my information. When I came from London, they sent me a letter saying that, but overwhelmingly they have requested me to come again, and they just feel amazing of the contribution that I had. And that really led me to push into creating my digital training program, and then people can come and train on site here. Especially, yeah, go ahead.
Well, I was just going to say that so many doctors are starting to realize the inadequacies of straight allopathic medicine at this time, meaning for those listening, here's my problem and here's the drug for that problem. And so with IV therapies, I saw that you do glutathione, you do the Myers cocktail. Can you explain to our viewers what a Myers cocktail is? Because it's not something that is well known outside of the alternative.
Myers cocktail really is the minimal thing you could do, which is given just a minimum amount of minerals that are necessary. See, we're electromagnetic, okay, and we're ionic, and if you don't have and especially we're all loaded with heavy metals, so our polarity is off, okay, and when you lack so much magnesium and your polarity is off, you want to give them enough magnesium, because magnesium is a massive cofactor for over 300, 400 really processes or chemical reactions in the brain, so in the whole body. So if you don't have enough of that magnesium, like I tell you, I am an ER doctor I'm a pediatrician by training. I trained pediatric oncology at Emory and St. Jude Hospital, and then ended up doing ER medicine. I've never understood why God led me to all this, but it was a big purpose. But when I started realizing the power of magnesium, they were about to attack me because I was in the ER. Anybody has a headache, I said, give magnesium. Anybody has this arrhythmia, give magnesium. But, and now they're all attacking me, and now everybody is using it. Get studies after study proves that for cardiovascular health, for neural health, for everything else, magnesium is essential. And that's one of the components that you have in a Myers cocktail. And then in another component.
Excuse me, for the viewer's sake, in a Myers cocktail, by taking the magnesium that's in it intravenously, you're able to, it can work faster or absorb better?
Well, not only that, see, the bowel is really, our bowel is so dysfunctional, not only because we're not absorbing, but we're not digesting. And we have already, what your questions really lead from one thing to the other. Our gastric acidity is not existing. And instead of really giving us acid, everybody's on antacid.
Right.
It competes with magnesium absorption.
Right.
So you are in.
Exactly. People are taking antacid.
Yeah.
Yeah, well, I'm just saying people are taking antacids to take away that burning in the stomach, and really what's causing the burning in the stomach is a lack of acid,
It's
right?
exactly right. I mean,
Right.
so, and then that causes dysbiosis in itself, because the gastric content needs to be acidic, and most people are very not even aware of that. So for me, it's a whole. But how can I teach all that in one session? So my patients comes often. They come twice a week sometimes to get IV therapy. We do a lot of stuff like that until I restore gut health while I'm giving all the minerals, because you need to have a healthy brain. So I give the minerals to restore the brain, so the brain is not chaotic, it's not on fire. It's like your wires that are all exposed.
When you do this for a patient, is it because you did lab work to see where the deficiencies are, or you just know in front that if they're experiencing this kind of anxiety, this is what that patient needs?
No, I assume, and I'm right most of the time, that all of us are deficient in minerals, all of us. So and all of us are deficient in amino acid. If you're eating food that is void of of protein and you're eating mystery food, you have no proteins. And if you have protein, you're not even digesting protein. And if you're digesting protein, you're not even absorbing the protein. So I do know that even if you're absorbing protein, you're absorbing not amino acids, because you have to absorb amino acid, not protein. If you absorb protein, that's leaky gut syndrome. You need to absorb amino acid, which is the building block of every single neurotransmitter in the brain. So I give them, while I'm waiting for the lab, because they come, they understand the process. I tell them it's going to take that long at least to get better. I need to treat you with this. I believe until the lab is back, which is about a week to 2 weeks at the most, I need to recommend, because you're so anxious, I really want to make sure that I give you enough IV therapy to help restore the brain. In the same time, I get the inflammation down so we don't have neurodegenerative diseases and neuroinflammation. So I work on trying to balance things out until the lab is here. When the lab comes back, that is going to include a spectrum of all the hormones, from the IGF-1 to DHEA to testosterone to estrogen. I see all that. But I really focus mostly on restoring the neurotransmitter before I restore hormones. I've never been a fan of restoring hormones before restoring, and that's why what I do is called neuroendocrine restoration program. So,
Okay, so neuroendocrine would be brain first, hormone second.
I hate to tell you, because I know that, and what is progesterone does, it works on GABA. I mean, if you take oral progesterone, it's a GABA. It enhances GABA. It becomes, once it passes through the liver, it becomes a pro GABA. So what is GABA? Is neurotransmitters, right? So I work on restoring the neurotransmitter balance. I mean, you can't be healthy. And then I work on mitochondrial health. I mean, I focus on energy. You can't do anything without gas. If you don't have healthy gas, you can't restore anything. You can't restore your thyroid, you can't restore your cortisol, you can't restore anything. I can give you all the vitamins in the world. So you need...
So is that as simple, for the viewer's sake, the mitochondria is the energy center in the middle of each cell in our body, and that's what we are, 90 trillion cells or so. Is CoQ10 the answer to
it's one of
mitochondria health?
It's one of the answers. Besides CoQ10 and L-carnitine and D-ribose and NAD-NADH ratio, I mean, it's just a whole system.
Right.
So
how do you get people to take, I get so many people that like to ridicule me for the amount of supplements I take every day, because I so believe in it in today's world. How do you get people to accept taking these large amounts of supplements for health in the new damaged world? That's what we're living in, a damaged world.
It is a damaged world. That's why part of what I want to do is restore the planet. Okay, I can lead a horse to the water, but I cannot make it drink. So when I have decided it's not my place except to show you, so I'm your coach, you're the captain of the ship. You either follow me or don't. I'll help you in any way you can. I never fight, and you know what? Everything I recommend, everybody gets. They trust me to the point that I don't even know how to explain it. I mean,
so that goes back to how this started, because we're almost out of time.
Oh.
When we first began, and I'm so enjoying talking with you.
God bless you. That's a pleasure is mine.
Yeah, and thank you. It's trust, right?
It is trust.
I'm not feeling well. I'm looking for a doctor who understands how to help me navigate through this damage process. What are your thoughts your closing thoughts in this? Because we have about 40 seconds left.
Okay, what my closing thoughts is really, you need to be the example. You are an example. When they look at you, if they don't want to believe you, that's their choice. You are an example. Also, doctors need to talk, and doctors need to heal. I can't heal you if you don't heal me. My patients see me hooked up in the IV. I don't really, it doesn't matter to me. I get with them and we get IVs together. I mean, it's just, it happens. So it's true. I have pictures, I have videos. They're family. I love them. I need to heal as a physician. That's why I created a program called Heal the Healer.
So you are personally involved.
Absolutely.
And I know that the people who are watching this have been looking and looking and looking to find a doctor who gets it. It's been a pleasure speaking with you. For all of you who are watching this interview with Dr. Akoury, who knows her stuff, as you can pick up from listening to her, go to foreverhealth.com and you can find her there. And I thank you so much for your time.
Well, Suzanne, it was really my pleasure, and truly my pleasure. I think together, you and I and many others will join forces and really transform the world back again. Because I believe that health is the new wealth. If you're not healthy, there's nothing. You have nothing, absolutely nothing.
I'm in complete agreement. Thank you so much.
I love you too. Many blessings.